Bifurcation lesions may be noted in almost one-third of cases for percutaneous coronary intervention. Outcomes for bifurcation lesions are worse compared to non-bifurcation lesions. Two important strategies for addressing a coronary bifurcation lesion are planned one-stent strategy or provisional stenting and elective two-stent strategy. In provisional stenting, side branch is stented only if unavoidable. A multicenter registry of 2044 patients compared the two strategies in non-left main bifurcation lesions. There were 1,551 bifurcation lesions of left anterior descending coronary artery and 493 non-LAD bifurcation lesions. Target lesion failure was the primary outcome evaluated in the study. It was a composite of cardiac death, myocardial infarction, and target lesion revascularization. Over a follow-up period of 38 months, non-LAD bifurcation lesions treated with two-stent strategy had more frequent target lesion failure, 20.7% versus 6.3%, P less than 0.01, and target lesion revascularization, 18.2% versus 6.3%, P less than 0.01. There was no significant difference in the outcome among LAD bifurcation lesions between the two strategies. Authors of the report suggested three possible reasons for the difference between LAD and non-LAD lesions in their study. 1. Less frequent use of final kissing balloon inflation in the non-LAD group. 2. Less frequent use of intravascular ultrasound-guided PCI. 3. Difference in the angle between the parent vessel, main branch and side branch. The angle between parent vessel and main branch was wider in non-LAD bifurcation lesions compared to the LAD bifurcation group. 15th consensus document from the European Bifurcation Club, published prior to this report, had also mentioned that while using a two-stent strategy, failure to perform a final kissing balloon inflation may jeopardize clinical outcome. They had also highlighted the importance of intracoronary imaging in bifurcation stenting. RAIN registry was a retrospective multi-center registry enrolling patients with coronary bifurcation lesions or left main disease treated with thin strut drug-eluting stents. A RAIN sub-analysis had 1,803 patients with non-left main bifurcation lesions, of which 59% had acute coronary syndrome and 41% stable coronary artery disease. After multivariate adjustment, post-dilation and provisional stenting were associated with lower target vessel revascularization. Use of final kissing balloon was associated with a lower incidence of target vessel revascularization in the two-stent subgroup. A previous study had reported 2-year outcomes of non-left main coronary bifurcation lesions treated with two-stent strategy using second-generation drug-eluting stents. They concluded that bifurcation location in the left anterior descending artery and its diagonal branch was protective against target lesion revascularization. Multiple stents implanted in either the main branch or the side branch was associated with target vessel revascularization.